Are you tired of living with hip pain? Have you been told by your doctor that you might need surgery? Hi, I'm Dr. Marc Adelsheimer with Regenexx Pittsburgh, Southwestern Pennsylvania's premier provider of non-operative regenerative solutions. So let's talk about different options for hip pain and how we can treat this. In this talk, I'm going to focus on various treatment options to you, beginning with conservative treatments, interventional treatments, and lastly, whether or not you should seek surgical opinions. I will also discuss who is an ideal candidate for a Regenexx procedure. So how do we treat hip pain? The first and most important aspect of treatment for hip pain is making an accurate diagnosis. If the problem is mild, it's very correct to start with conservative treatment, which may include anti-inflammatory medications, physical therapy, rest, and basic exercises. When this doesn't work for treating your pain, it's time to start looking at alternative solutions.
Hey, I'm sorry for interrupting this video. This is Dr. Lieber, partners of Dr. Sally, and I just wanted to reach out to you just letting you know that if you're in pain, you're welcome to call the number that's listed below so that we can help. Now back to Dr. Adelsheimer's video.
At Regenexx Pittsburgh, we provide non-operative, regenerative orthobiologic solutions to help with hip pain. Specifically, we're talking about platelet-rich plasma and bone marrow concentrate, which are very valuable in treating many hip problems. Platelet-rich plasma is an excellent solution for many hip problems, especially problems that haven't gotten better over the first few months. Often, strain-sprain injuries causing bursitis, tendonitis, or even early arthritis can be treated with platelet-rich plasma. This is a very safe and easy alternative to surgical options. This is done as an outpatient in our office under ultrasound guidance in a very safe environment. Conditions such as large labral tears, early osteoarthritis, or avascular necrosis can be treated with bone marrow concentrate. An appropriate evaluation by a physician and an accurate diagnosis can lead to this solution being an option for you. Any regenerative treatment is always combined with an appropriate exercise program through rehabilitation. We generally recommend physical therapy, an evaluation of patient's gait, which is your walking ability, exercise, flexibility, and strengthening. These are important aspects to add to your treatment plan. Surgery is often the last resort and only necessary for severe cases. Severe end-stage arthritis may require surgery, but often arthritis can be treated earlier without surgery. Most labral tears can be treated without surgery, and surgery should only be reserved for the most severe cases. Here at Regenexx Pittsburgh, we have many non-surgical options for hip pain that should be addressed prior to considering surgery. If during our evaluations we feel that your problem is severe enough that surgery is necessary, we will give you an honest opinion and refer you to a surgeon. So how are Regenexx procedures different from surgery? Here at Regenexx Pittsburgh, all of our procedures are done guided using musculoskeletal ultrasound and fluoroscopy, which is X-ray guidance. Why is this important? Because this ensures that our needles are in the exact location that we are placing our solutions. We have advanced training in both musculoskeletal ultrasound and X-ray guidance. Many physicians who are doing these injections are doing them blind, meaning they are just sticking their needle in and using their basic knowledge of anatomy to hope they are putting their needle into the correct location. They do not have the advanced training in musculoskeletal ultrasound or fluoroscopy, and therefore there is significant increased risk that the needle may be in the wrong place, and more importantly, it often doesn't improve the problem since the needle will be in the wrong location.